Your knee pain may not actually be starting in your knee. I know that might sound strange. Because when your knee hurts, the first thing we do is look at the knee. You run your hand over the front of the joint, press on the side, and try to figure out if it's arthritis, wear and tear, cartilage, or just one of those things that comes with life. But I need to show you something that changes everything. Sometimes the knee isn't the villain. Sometimes the knee is the victim. The victim of a weak muscle that should be protecting you every time you get up from a chair, climb stairs, walk around the house, or get into the car. That muscle is the glute. I've been a physical therapist for over 10 years, and in my clinic, I see people every day who come in with knee pain. They've tried everything: physical therapy, medication, rest, and the pain keeps coming back. And when I assess these patients, one thing shows up very often: weak glutes. Not because the person is weak, but because that muscle has been forgotten for years, and the knee has been paying the price. Over the next few minutes, I'm going to show you how to identify whether this is happening to you right now, and 3 simple exercises to start changing it today without straining your knee and without needing a gym. But first, I want you to do a test. Stand up near a sturdy chair. It can be the one you were just sitting on. Ideally, do this in front of a mirror so you can observe it better. Place your feet hip-width apart. Now sit down slowly and stand back up. But this time, watch your knees as you do it. Are they pointing straight ahead? Or does one of them slightly collapse inward as you stand up? Do it one more time, very slowly. If your knee collapsed inward, even just a little, there's a name for that. It's called dynamic valgus, and it's not the knee's fault. It's a sign that the muscle that should be controlling that movement isn't doing its job. Remember that, because in a moment, you'll understand exactly what's happening in your body and what you can do to change it. Let me explain what's happening in your body in a simple way. The knee doesn't work on its own. It's part of a chain. Below it, you have the foot and the ankle. Above it, you have the hip and the glutes. When this chain works well, movement flows. Your body weight is distributed properly. The knee stays protected. But when the glute is weak, the hip loses control. And when the hip loses control, the knee starts receiving forces in the wrong directions. Every time you walk, stand up, climb stairs, or get into the car. Think of it this way: the knee is like a hinge in the middle of a door. If the structure around it is out of alignment, that hinge is going to suffer. Not because it's weak, but because it's receiving the wrong kind of pressure from every side. And here's the worst part. The person doesn't feel anything in the glute. They feel it in the knee. They feel it in the lower back. They feel tiredness in the legs. And they keep thinking the problem is in the knee. That's why so many people do knee exercises, take anti-inflammatories, use ointments, rest, feel better for a few days, and then the pain comes back, because the source of the overload is still there. Now let me tell you about 2 patients I treated, because you might recognize yourself in one of them. Mr. Robert is 72 years old and loved walking. He used to do it every morning, 40 minutes, in the same park. But a few months ago, he had stopped, because after 10 minutes of walking, his knee would start to feel so heavy that he had to turn back. When I assessed him, I noticed his hips swayed a lot with every step. His body shifted its weight from side to side, as if it were trying to stay balanced the whole time. Those were the lateral hip muscles crying for help, and the knee was paying the price with every step. Then there was Mrs. Anna, 65 years old, who was afraid of stairs, not afraid of falling. She held onto the handrail just fine. She was afraid of the pain, because every time she stepped up, she felt strong pressure in the front of her knee. When she climbed a few stairs slowly for me, I saw that she was pulling almost everything from the front of her thigh. The glute was barely involved in the movement. It was as if the main engine was turned off, and the knee was trying to do the job instead. Maybe you recognized yourself in Mr. Robert or Mrs. Anna. Maybe a little bit in both. And the good news is that both of them improved, not because they did some complicated treatment, but because they woke up the muscle that had been sleeping. And that's exactly what we're going to do now. Before we begin, one important note. These exercises were chosen especially for people with knee pain. They don't strain the joint. They work the glute in a way that allows the knee to rest while the right muscle learns how to do its job. But if you feel pain during any of them, stop. Pain is a sign that something needs to be adjusted. Now let's get started. Exercise 1. We're going to start with an exercise that looks simple, and it is. But don't be fooled by its size. This movement goes straight to the side of the glute. That's exactly the area responsible for keeping your knee in place when you walk, climb stairs. Remember the dynamic valgus you tested at the beginning, when the knee collapsed inward. This exercise starts to correct that. Lie on your side on the floor or on your bed. Rest your head on your bent arm. Keep your body aligned. Your bottom leg stays slightly bent, just to give you more stability. Your top leg stays straight. And here's an important detail. Keep your foot at a 90-degree angle, with your toes pointing forward, not up toward the ceiling. That detail changes everything, because it makes sure the work goes to the glute, not to some other random muscle trying to steal the show. Now slowly lift your top leg. You don't need to go high, about 12 inches is enough. Hold for 1 second at the top, then lower it with control. Don't let it drop. Do 10 repetitions on each side. Rest for a bit. Then repeat one more time. 2 things to watch for. If your hip starts rotating backward as you lift your leg, your body is cheating. Lower the height and keep control. And if you feel it more in your back than on the side of your hip, go even slower. The muscle needs to learn how to work again. That takes a little time. Now that you've woken up the side of the glute, we're going one step further. Because activating the glute from the side is important. But the glute also needs to learn how to push, to generate upward force. Exercise 2, glute bridge. Lie on your back on the floor or on your bed. If you're on the floor, place a rug or exercise mat underneath you to make it more comfortable. Bend your knees and keep your feet flat on the floor, hip width apart. Your arms stay by your sides with your palms facing down. Now, before you lift, do just one thing. Squeeze your glutes. That's it. Don't lift yet. Just squeeze and feel the glutes contract. This moment matters. Because many people lift their hips using their lower back or the back of their thighs, with the glutes barely joining the party. And that's not what we want. We want the glutes to do the work. So squeeze your glutes, press your feet into the floor, and slowly lift your hips until you form a straight line from your knees to your shoulders. Hold at the top for 2 seconds. Keep squeezing. Then slowly lower back down. Control the descent. Don't just drop. Do 10 to 12 repetitions. Rest. Then repeat one more time. If you feel a cramp in the back of your thigh, bring your feet a little closer to your hips. This takes the work away from the hamstrings and puts more of it into the glutes. If you feel pressure in your lower back, don't lift so high. Halfway is already enough. The goal isn't to lift high, it's to feel the glutes working. As it gets easier, you can increase it to 3 sets of 15 repetitions, and you can hold a few more seconds at the top. This works the isometric contraction and helps with support. Now you've activated the side glute. You've trained it to push and generate force. There's just one thing left. Taking all of this into the movement you use most in real life. Exercise 3. Squat with resistance, band. This is the most important exercise in the video. And I want you to understand why before you start doing it. Everything we've trained so far, activating the side glute, generating upward force, was preparation for this moment. Because it doesn't help much if your glute works while you're lying down, but not when you're standing, moving, and living your life. And this is where the resistance band comes in. If you don't have one, it's an investment that's worth it. It's very affordable on Amazon, and I'll leave the link in the first pinned comment. The band isn't here to make the exercise harder. It's here to teach you something. Because when you place the band above your knees and feel that resistance pulling your knees inward, your glute is forced to wake up and hold them in place. That's exactly what should be happening with every step you take. Every time you get up from a chair, every step you climb. Let's begin. Place the resistance band just above your knees. Now gently open your knees outward, as if you were trying to push the band out to the sides. Keep that outward push throughout the entire exercise. Don't let your knees collapse inward at any point. That detail is the heart of the exercise. Now slowly lower yourself toward the chair, as if you were going to sit down, but stop before touching it. Hold for 1 second, then come back up by pressing your feet into the floor, keeping your knees open against the band. Do 8 to 10 repetitions. Rest, then repeat 1 more time. If you need support, place a chair in front of you and hold on lightly. There's absolutely nothing wrong with that. What matters is control, not perfection. 3 things to watch. Your knees should not collapse inward. If that happens, the band will remind you right away. Your body weight should go into your heels, not the balls of your feet. If you feel your weight shifting forward, push your hips farther back. And notice whether your glutes are working. If you feel it more in the front of your thighs, lean your torso slightly forward and push your hips farther back. Now repeat the test you did at the beginning. Stand in front of the chair. Sit down slowly, then stand back up. Look at your knees. Did anything change? Maybe your knee already feels a little steadier. Maybe the movement already feels a little more controlled. That's your glute starting to do its job again. I need to tell you what happened to Mr. Robert. Remember him? The man who loved walking in the park every morning but had stopped because his knee felt too heavy after just 10 minutes? He started doing these 3 exercises. In the first week, he already felt a small difference. His knee felt less heavy and he could walk a little longer. By the 3rd week, he went back to the park. Not for 40 minutes yet, but he went back. He got excited, and then he stopped doing the exercises. Because when pain improves, we tend to think the problem is gone, that the body has healed, that we don't need to do anything anymore. But the glute doesn't work like that. It doesn't get stronger in 2 weeks and stay strong forever. It needs to be reminded. It needs to keep being used. Because if you stop, it starts to weaken again. And the knee goes back to paying the price. Mr. Robert came back to the clinic 2 months later. The pain had returned. And this time, it was a little worse than before. Not because he had done something wrong, but because he had stopped doing what was right. So before you close this video, I want to leave you with a simple and realistic guideline. You don't need to do this every day. You don't need an hour-long workout. You don't need a gym. 3 times a week is already enough to keep the glutes active and the knee protected. Monday, Wednesday, and Friday, or Tuesday, Thursday, and Saturday. Any combination that fits your routine. Each session takes less than 15 minutes. You can do it in your bedroom, in the living room, on the balcony, without leaving home. And if one day you forget, that's okay. Come back the next time. The mistake isn't forgetting one day. The mistake is giving up because you forgot one day. Mr. Robert understood that the second time. He started doing the exercises again. He went back to the park. And this time, he didn't stop. I need to remind you that knee pain can have many causes: arthritis, inflammation, meniscus injuries, tendon problems, foot changes, excess weight, a history of surgery, among others. In this video, we talked about one of them, a cause that shows up very often and is often overlooked: weak glutes. But if you did the exercises, followed the guidance for a few weeks, and the pain didn't improve or got worse, don't keep pushing through on your own. See a doctor to understand what's happening in your knee. And seek guidance from a physical therapist to get an exercise program designed specifically for your case. Because what works for most people may not be what your body needs right now. This video is a starting point, not a replacement for a professional evaluation. If you've made it this far, you already know something many people don't: that the knee isn't always the problem, that it may be silently suffering because of a muscle that became weak without you noticing, and that 3 simple exercises done 3 times a week can completely change the way you move, the way you feel, and the way you live. Mr. Robert went back to the park. Mrs. Maria gets out of bed without holding onto the wall. Mrs. Anna climbs stairs without fear, not because they did something extraordinary, but because they didn't give up. And you don't have to either. Now do me a favor. If this video made sense to you, if you recognized yourself in any of these stories, if your knee collapsed inward during that test at the beginning, share this video with someone you know who also struggles with knee pain. It could be a family member, a friend, someone in a group chat, because this information could change the life of someone who is suffering without knowing why. And if you want to keep learning how to take care of your body in a simple and safe way, subscribe to the channel and turn on the notification bell. There's new content here every week, always made with you in mind. See you in the next video.